So here we are going to discuss few question and answer about safety and effective care or management care. The question number one, the nurse is making a staff assignment on the medical and surgical unit. The nurse should assign a nursing assistant to care for which of the following client? So this question came about the delegating. So when you work as an RN, you have to distribute the jobs or role for CNA, for LPN. So there are 4 patients. Which patient is good for, nursing assistance care or the role of a CNA? We know the CNA can do or provide the routine non-skill care, such as bed making, bed bath, routine vital sign checkup, if patient is stable, put enemas or oropharyngeal suction, right? So there are 4 patients. Number 1, client diagnosed with a cerebrovascular attack or CVS or stroke 2 weeks ago. So almost 14 days ago, and patient is stable now and requiring assistance for ambulating. So this patient is stable and CNA can do for non-skill care, and this patient need ambulating movement. CNA can help. Why we do not choose number 2, 3, or 4? Number 2, a client diagnosed with COPD who is acute distress, require assisting breathing. So patient diagnosed COPD and it is the acute distress continued. There, patient needs some assessment and skill work. Definitely CNA is not good for this. Number 3, a client receiving total parental nutrition through the PICA line. So through the PICA line or total parental nutrition. So if the patient take the total parental nutrition or PICA line, definitely we need RN or central line care is not easy. It is the IV line we use for medication or chemotherapy, or we give long-term antibiotic therapy. Most of the times we use subclavian artery or femoral artery. And infection control is very important or priority to prevent infection. So peripherally inserted central catheter is called PICA line or PIC line. Sometimes we use Potacath, but both is very complicated. We need very skilled healthcare provider. Total parental nutrition always we do by RN, right? So this is the role by RN. So here we do not choose the CNA for this. And number 4, the client diagnosed with type 1 diabetes and type 1 diabetes, it is okay, patient is stable. But you see, second half of the this say patient on mechanical ventilation. So it is the skill care, need RN. So definitely we will not choose the CNA. When a patient comes to the hospital, need to assessment, always aren't supposed to do this. Support a patient need care of plan of care, always RN. Support a patient is most critical, unstable patient. If patient need fresh, post-operative client, always RN supposed to there. If the client need to change the condition, who need assessment, always RN do this. During the admission, RN should do this. During the discharge, RN should do this. Or transfer from one unit to other unit, RN supposed to do this. And also, assessment available staff or their job description done by RN, and perform some most complex procedure, example, starting IV channel, or interpret the EKG, or correlate lab values, always by RN, or collaborate with other departments for discipline or interdisciplinary approach, always done by RN, or direct or supervision by LPN, who can supervise LPN, RN, or if need any kind of client advocacy, also role of RN. Support a patient is very stable, LPN can do this. So provide care to a client in a stable condition under the supervision of RN or other healthcare provider, LPN can take care of them. Like patient need perform the basic therapeutic or preventive care or rehabilitative procedure like sterile dressing change or urethral catheter, NG tube insertion, application of restraint. The LPN can do this, but under direct supervision of RN. LPN can do this. Supervision of RN. Assist RN with unstable or complex client. Right? Imagine we need the triage, perform triage, never ever do by LPN. If patient need admit IV chemotherapy, LPN never do this. If patient need or perform central line procedure, LPN never do this. If need blood transfusion, LPN never do this. Next question here. The nurse cares for a client diagnosed in stage 1 chronic kidney disease. During the nursing assessment, the nurse expects the client to make which statement? So chronic kidney disease, stage 1. There are 4 options. So which complaint or sign and symptom patient can come and tell to RN who has chronic kidney disease stage 1. Number 1, I do not seem to urinate as much as I used to. So it means patient has a anuria or scanty of urine, but it is not the sign of stage 1 chronic kidney disease. Number 2, I seem to have a more swelling in my feet and ankle. It means patient has a pitting edema but pitting edema develop in end-stage renal disease, not stage 1. Number 3, I urinate more at night. So this is the answer because the stage 1 chronic kidney disease patient has a problem. At the beginning, they go for urine more at night. Number 4, healthcare provider told me I need dialysis. So it is not related to the sign and symptom of stage 1 chronic kidney disease. So number 4 is not an answer. So this said, what is their explanation? Oliguria occur during the stage 2, not stage 1. What is oliguria? Means scanty, small amount of urine. I do not seem to urinate as much as I used to. It seems to have more swelling in my feet and ankle. It is number 2, occur during the stage 2. And stage 1 diminishes the kidney reserve function. Kidney function is reduced, but healthy kidney is able to compensate what is occurring in stage 1. Since the kidney not as able to concentrate the urine, client has a polyuria and nocturia. Excess amount urine passing, or nocturia, at the night time urine passes more. Next question. The home care nurse visit a client receiving lipothyroxine. So lipothyroxine, other name is called synthyroid. This is the medication we use for hypothyroidism. So lipothyroxine or synthyroid 75 microgram OD. The client tell the nurse that he has been experiencing insomnia last couple of weeks. What are the following response by the nurse is the most appropriate? As I told you, lipothyroxine or synthyroid we give for hypothyroidism. When we give this medication to the patient, it is important to educate about these drugs. What is important about lipothyroxine? Before to start lipothyroxine, we have to count down the pulse rate. So it is good to hold the medication if the pulse rate greater than 110. Or let me recap it. If our patient take lipothyroxine, it would be good we hold the medication if we get the pulse rate more than 110 beats per minute. And lipothyroxine takes 1 week to start work. So it is, if you take today and tomorrow you think medication can start, it is not like this. It takes 1 week to work. And also, lipothyroxine can cause insomnia. It is good to take at the early morning. And definitely lipothyroxine have some adverse effect, like patients sometimes complain flushing, anxiety, headache, insomnia, tachycardia, hypertension, or palpitation. So if patient has insomnia, our patient complain about insomnia. So as I told you, how to avoid insomnia, tell your patient to take the medication at the morning time. So during the night time, they can adjust. So most appropriate question is here, when do you take this medication? Right? So let me read rest of them. Physician may have decreased the dose. Tell me what your bedtime routine. And number 4, take a warm bath before going to bed. Out of 4, number 3 is the best option. When do you take the medication? What is the explanation? Why number 3? So should take the medication means lipothyroxine before breakfast to prevent insomnia. Lipothyroxine can cause insomnia. It is the adverse effect. The next question, the nurse care for a client on neurologic unit. After reviewing report, which of the following clients should the nurse take first? Neurologic. Number 1, a client who is non-responsive with a treatment intermittent limb movement. So patients are not responding, right? So this question actually came about the prioritization, right, or triage. So second, a client who has muscle tone. Muscle tone of all 4 limbs is flaccid type of paralysis. So what we do? Number 3, client who is a non-responsive but follow the staff with his eye. So this patient is not under coma. Glasgow's coma scale, if you evaluate, this patient is oriented. Number 4, the client who immediate withdraw from the painful stimuli. Number 4 is very stable and responds to the painful stimuli. So what are the most priorities? So always life-threatening injuries patient or survival with minimal interval, we go for the check first. If any patient come with anxiety or apprehension, restlessness, confusion, or change in level of consciousness, we will go first to check them. So here they said a client those muscle tone of all limbs, superior extremity, lower extremity, 2 hands, 2 foots are flaccid. Flaccidity, the most indicative of serious, irreversible impairment. So if you help them little bit, your patient can prevent the damage or danger. So flaccidity is important. So if you ask me what is flaccidity, what is flaccidity or what is flaccid? So it is means lacking the normal or muscle tone is lost. Flaccid muscle. It is called lacking the firmness of muscle, hanging muscle or flaccid muscle, or lacking the force, effectiveness. Next, here. So while sitting at the front desk, completing an assessment sheet, A new graduate nurse asks the nursing assistant perform the finger prick blood sugar for assigned client. So the nurse assistant responds, why cannot you do it? Which of the following response by the nurse is the best? So blood sugar level check. So to check the blood sugar, sometimes patient can do this. So why not CNA can do this? They should do this, right? The role of CNA, as we know, they can provide routine work, non-skill care, routine vital sign check, put the enema or blood sugar check. They can do this. So now the answer, please page me when you have complete the task. Why it is the answer? Performing a finger sticks is within the scope of practice of nursing assistant, and tasks should be carried out as a delegate. So it is the non-skill care. Patient is stable. If patient is stable, routine vital signs or putting enema, oropharyngeal suctioning can be performed by CNA. Same as blood sugar level is easy one. Why not number two, 3, and 4 answer? Number 2 said it is important that the blood sugar is complete now. Why did you ask that? Asking something why is not a good choice for NCLEX board. If you do not have time, I will ask someone else to do. So it is not it does not make sense. Number 4, right? So next question. A mother of 4 years old and tells the nurse she is worried about her daughter has begun to slaughter. So the mother asks the nurse what action can be taken to stop the shuddering, torturing or shuddering. Which of the following response by the nurse is the best? So what has been happening in your child's life? Number 2, reward your child when speaks frequently. So instruct your child to start over and speak more slowly. Number 4, whatever it is, slow down your own speech and talk to your daughter clearly. Why number 1 is not answer? They said implies that something is wrong. Broken fluency is a normal occurrence in a speech scholar. Number 2, reward. So because it is a normal behavior and there is no reason to offer any reward. Number 3, instruct your child to start over and speak more slowly. Why it is not answer? Will make the child conscious of speech and increase the slurring. And number 4, slow down. Why this answer? Because does not call attention to the child's speech pattern and thus gives the child time and space to respond. Secondary shortening is a normal phase of language development. Next question. The mother of an 8-year-old boy is concerned because her son has starting to scam and refuse to eat. When left with the child care provider. So mother went at home with the baby, everything is okay. But when mother left the baby and baby stay with the caregiver, problems start. And our baby client age group is 8 months, right? 8 months. So during the 8 months, there's some thing is very normal to develop. We call developmental milestone. So it is important we have to know what age group our baby what like or what they do. So there are 4 options. Which one we prefer to take care of them? And let me explain here. So which of the following statement by the nurse is the best option? So when baby eat, when baby with mother, but when mother left, baby stay with the caregiver and baby refused to eat. And our children is 8 months old. So during the 6 to 9 or 9 to 12 months, in that times, baby develop the anxiety to separate from the mother or parents. So they said start looking for the different child care provider. Check your son for bruising or other injuries. Number 3, remember that there is just a phase your son is going through. Number 4, hand your child his breakfast as you say goodbye. Why child like this? Why? Exhibiting separation anxiety. When parents left the baby and babies develop the anxiety, it's called separation anxiety. So it is very important here. Reassure the child by offering favorite blanket or toy, and talk to the infant when leave the room, and allow infant to hear parents' voice over the telephone, right? So I said during this time, separation anxiety work in this age group. What next? A patient is to be discharged after a right total hip replacement. Which of the following statement is made by the patient to the nurse indicate that teaching has been effective? The keyword here, our patient have done the right total hip replacement. So movement is very important. 1, I cannot sit in my favorite recliner with my legs. Number 2, I should ask my wife to put on my socks and shorts. So which of the following statement is made the patient to the nurse indicate that teaching has been effective? So out of 4, which one is the correct after total hip replacement? Number 3, I should clean the incision with a mixture of hydrogen peroxide. And number 4, I do not need to continue to do the leg exercise I learned in hospital. So number 1 is not an answer because can sit in recliner as long as hip flexion is less than 45 to 60 degrees. Avoid stopping. Do not sleep on operative side until direct to do so. Why we choose number 2? I should ask my wife to put on my socks and shoe because this self-care activity would cause hip flexion greater than 40 to 60 degrees, and patient should avoid it and might cause dislocation of the hip and maintain abduction and do not cross the legs. It is very important to follow after total hip replacement. Next question. The community health nurse visit the home of care for school-age child. The child is diagnosed with a severely disabling migraine headache. What are the following instructions by the nurse is the most appropriate? Right? So 4 here, migraine. So what are the most important to follow? Here, they said, number 1, hire someone to help with the child, report excessive menstrual flow, avoid stressful situation, and go to the bed at the same time every night. Community health nurse visit home with a 4 school-age child. The client is diagnosed with severely disabling migraine headache. So if the patient has a migraine headache, what is the best option for them? They said, go to the bed at the same time every night. Why we choose it? Because fatigue is a trigger to start the migraine. Right? Fatigue is a trigger to start migraine. And also, if the patient has a simple migraine, we give them some naproxen. If patient has tension migraine, also we can give them some naproxen. But it is not talk about the pharmacological management. What are the non-pharmacological management? We have to stop the trigger. So number 1, hire someone may or may not be feasible for the client, or report the here excessive menstrual flow. They said fluctuating estrogen level have been related to migraine headache, but the amount of the flow does not appear to related in this question. Avoid stressful situation. So trigger include eating chocolate and cheese, not a stress, drinking coffee, and going for a long period of time between the meal. So it is the trigger. So if the children have the simple migraine, tension migraine, cluster migraine, right, which is better to stop the trigger, like not to eat chocolate or cheese, not to drinking coffee, and also better to avoid the fatigueness. Next question. The nurse in the outpatient clinic, assessment for an elderly client. The client start there. The spouse had a stroke 7 months ago, and the client cared for the spouse for 3 months. 4 months ago, the client had to place the spouse in a long-term care facility because of being no longer able to provide care. So at the beginning, try to help, but after 3 months or 4 months ago, leave to the long-term care facilities because it is difficult for the spouse. Since that time, the client report having lost 40 pounds. So 40 pounds loss, too much, right? And it is fearful to live alone. And the spouse is sorely missing the spouse. The nurse noticed that the client is extremely hard of hearing, which suggests should be the nurse make first. So this question is three option. One is patient weight loss, means patient do not eat. Emotional problem because missing the spouse, who, I mean, they are decide go to live in the different place. One is long-term care facility, other at home, and also it is fearful to live alone. So second two option is emotional, but according to the Maslow's law, the first is physiological needs, like if I'm hungry, you give me the food. Then come the question about the security. And then question come about the belonging needs. So I miss someone. This is the belonging needs. And fearful to live alone. This is the security needs. But a patient lose the 40 pounds means they do not eat well. Physiological need is the first priority. Survival needs is the first priorities. Means if patient need oxygen, give them oxygen. If patient need water, give them water. If patient need elimination, give them scope to eliminate, right? And physical and mental rest is important. And when you have everything, we go for esteem needs or self-actualization. So because of Maslow's law or Maslow's of need, the physiological needs before the psychological needs. So I'm going to refer you to meals, right? Food. According to the Maslow's, take care of the basic need first. So number two, not an answer because the client concerned the safety and security. Priorities make sure that the client eat because of the needs. Number one, I think you should move. The client is a candidate for a nursing home. Loneliness is not the reason to move to the long-term care facilities. Next question here. Charge nurse on the night shift receiving a call call one of the nurses who is report the next morning. The day shift nurse report that, and she has been diagnosed with Staphylococcus throat. Replace the antibiotics. Which of the following response by the charge nurse is the most appropriate? How long have you taken the sore throat? 5 days, 7 days, but it is not the appropriate question. Make the decision you will allow to work or not. Number 2, how long have you been on antibiotics? So if you start the antibiotics more than 24 hours or 48 hours, means you are safer to start your work. And number 3, do not have elevated temperature. Okay, do you have elevated temperature? Infection, bacterial infection always raise the temperature. But when you start the antibiotic, everything will be subside. And number 4, do you have a doctor's release to work? So they said, number 2, how long have you been antibiotics? This is the most appropriate question to ask. Why? After 24 hours of antibiotic therapy, Staphylococcus throat infection is no longer contagious. It is not contagious to others. And healthcare provider can start their responsibilities. They can start their works. And next question here. The nurse perform dietary teaching with a client who has hepatitis. So, which of the following menus is the good for the patient who have hepatitis, right? So, which food you should choose for them? So, let me read one by one here. So, if the patient have a hepatitis or pancreatitis, it is important to choose the food. And our patient has a hepatitis B. Hepatitis B, we know that transmitted by the blood and body fluid, right? So what are the need to know? The liver inflammation. So it is good to avoid fatty food or fat food. It is important good hand washing and also follow the contact precaution. So I said we choose the less fat. Number 1, hamburger. It is a lot of fat. Liver will fight to digest too much fat. Number 3, bacon, eggs, butter, milk, fat. Number 4, sauces, gravy, buttered, also fat. Number 2 is less fat because lean roasted beef, potatoes, green beans, and coffee. So also number 2 is high carbohydrate and low fat. It is the most suitable for the patient who have hepatitis. Next question, the nurse admit a patient to the cardiac unit with a diagnosis of heart failure. It is the most important for the nurse to clarify which of the following were by the physician? So if anybody diagnosed with a heart failure, cardiac unit heart failure, which is the most for them following? Furosemide, then number 2 grams a day sodium diet, sodium. Number 3, normal saline at 125 milligram per hour IV and oxygen 2 liter per nasal cannula. Why we choose number 3? Why? Heart failure patient. So in this patient, why not choose furosemide? Why not choose oxygen? First of all, appropriate water loop diuretics that promote the excretion of excess water, decrease blood volume and pressure in the left ventricle. So number 2, appropriate water, because extracellular fluid is primarily regulated by sodium. Low sodium diet must need for heart failure. So why you give them extra sodium? No need. Normal saline. Why? Because the patient may have excess fluid volume. Maybe on the fluid volume restriction, and daily weight measurement is important. It indicates patient has a retention of fluid or not. Also, strictly maintain input and output chart. So if the patient had heart failure, the normal saline is good at rate 125 milligram per hour. Next question. A nurse determines that which of the following client is the most at the risk to develop gastroesophageal reflex. So out of this, which patient is most risk to develop gastroesophageal reflex, right? So number 1 here said is 16 years old. So if anybody is 16 years old, they have a less chance or no chance to develop gastroesophageal reflexes, right? So we will not spend our energy on it. So better to go for the next one. Here, 16 years old. Number 2, 13 years old female with the diagnosis of cholelithiasis. Cholelithiasis means stone in the gallbladder, and patient is under TTO. So it is not related to gastroesophageal reflex formation. Number 4, 65 years old man with a laryngectomy and laryngeal cancer. So also larynx disorder not related to gastroesophageal reflex. Number 3, a 52 years old female who 5.5 to 5 tall. So 5 feet 5 inches. And body weight 185. So it is obesity. Obese patient, BMI is higher. So obese person 52 years old, more chance to develop gastrointestinal reflex disorder. So GERD is a gastroesophageal content flowing back direction into the esophagus. The risk factor include female. Number 3, 52 years old female. Over the age 45, my patient is 52. But number 5, 65 years it is more than 45 years old, but man. But risk factor female, over age of 45, obesity. Number 4 does not talk about anything about obesity, but here the body height and body weight mentioned, we can calculate body mass index. It is indicate The patient is obesity or obese. GRD appears more often in a Caucasian. Number 3, Caucasian also. Next question here. The nurse care for a pregnant client with a diagnosed sickle cell crisis. Which action should the nurse take first? So if anybody have sickle cell disease, they complain sometimes pain, and pain occur because of sickling the red blood cell. How we can avoid it? Give them water, hydration. Hydration can prevent it. So admin oxygen. It is not a choice because I need hydrated my patient. Number 2, the client in the right side position. It does not make any sense. Not related to the sickle cell disease. Number 3, begin IV with a normal saline. So it is water. Patient dehydrated, pain is more. Sickling will be increased because of sickle cell anemia crisis. Give them water, give them hydrated, give them normal saline. And admin antibiotics. So antibiotics do not have any role play here. So dehydration is one of the precipitating cause of sickling of the red blood cell. Intake should be at least 200 ml per hour. If your patient is rehydrated or dehydrated, it is important or make sure rehydration. Next question. The nurse prepared a client for a skin biopsy. Which of the following statement is made by the client should the nurse report physician? Number 1, I have been taking aspirin for my aching pain. So aspirin increase the bleeding time. And patient go for skin biopsy and give the history, I took aspirin. Better not to go today. At least 3 to 4 days before you have to stop intake of aspirin if you go any kind of invasive procedure like skin biopsy. It is important to notify healthcare provider. Number 2, I applied lotion. Does not matter. You can clean it. I lay down in the sun yesterday. Does not make any sense. Not related to this. I had coffee and sweet roll for breakfast this morning. It also does not impair. So aspirin can increase the risk for bleeding and should be reported because we need to stop the aspirin at least 2 to 3 days before the skin biopsy, or sometimes we need to stop at least 1 week before go for any kind of surgical operation.